How common stress fracture in pediatric foot and ankle. A stress fracture is a small crack in the bone that often results from repetitive force or overuse. While commonly associated with adults, stress fractures also affect children, especially those who are active in sports or physical activities. Pediatric foot and ankle stress fractures are less frequent than in adults, but they are not uncommon, particularly in young athletes. Here's a closer look at the causes, symptoms, treatment, and prevention of stress fractures in children. Causes of pediatric stress fractures. Children's bones are still developing, making them more resilient to certain injuries. However, high-impact activities, poor conditioning, or improper footwear can lead to overuse injuries such as stress fractures. Sports like basketball, soccer, gymnastics, and running can place excessive stress on the bones of the foot and ankle, increasing the likelihood of a fracture. Other contributing factors include rapid growth spurts. As children grow, their bones can be more susceptible to injury. Overtraining. Excessive activity without adequate rest can weaken the bones. Improper footwear. Wearing shoes that do not provide proper support can strain the foot and ankle. Nutritional deficiencies. Lack of calcium or vitamin D may weaken bones, making them more prone to fractures. Symptoms of pediatric stress fractures. Stress fractures may not always present immediate or clear symptoms, which is why they often go unnoticed until they worsen. Children experiencing stress fractures in the foot or ankle might report pain during activity. The pain usually subsides with rest, but may gradually become persistent. Swelling. Swelling or tenderness may appear at the site of the fracture. Difficulty bearing weight. Children may have trouble walking or standing due to pain in the affected area. Bruising. In some cases, minor bruising may develop near the fracture. Diagnosis and treatment. Timely diagnosis is crucial for managing stress fractures and preventing further complications. A podiatrist or orthopedic specialist will typically assess the child's medical history, activity level, and perform a physical exam. Imaging techniques like X-rays or MRI scans may be necessary to confirm the diagnosis. Treatment options. Rest. The primary treatment for stress fractures is rest. Children should avoid activities that put strain on the affected foot or ankle until the fracture heals. Immobilization. In some cases, a cast or walking boot may be recommended to stabilize the foot and promote healing. Physical therapy. Once the bone begins to heal, physical therapy can help restore strength and mobility in the foot and ankle. Gradual return to activity. A structured return to activity plan can help prevent re-injury. Preventing pediatric stress fractures. Prevention plays a significant role in reducing the risk of stress fractures in children. Parents, coaches, and healthcare providers should work together to promote the following habits. Proper footwear. Children should wear supportive shoes that fit well and are appropriate for their activity. Balanced nutrition, ensuring adequate intake of calcium, vitamin D, and other bone-healthy nutrients supports bone strength. Cross-training. Incorporating various types of physical activity can reduce repetitive stress on specific areas of the foot and ankle. Adequate rest. Allowing time for rest and recovery between training sessions can prevent overuse injuries. When to see a podiatrist. If a child complains of persistent foot or ankle pain that worsens with activity, it's important to consult a podiatrist. Early diagnosis and treatment of stress fractures can help children avoid prolonged discomfort and return to their favorite activities safely. At Feet and Beyond, we specialize in pediatric foot and ankle care, including non-surgical treatments to help children heal and return to their normal activities with minimal downtime. Stress fractures in the pediatric population, while less common, are still a significant concern for young athletes and active children. With proper care, most stress fractures heal without complications. If your child is suffering from foot or ankle pain, visit Feet and Beyond for a comprehensive diagnosis and treatment plan tailored to your child's needs. Our pediatric podiatry services ensure that your child receives the best care for fast recovery.